I'm going to talk about low methotrexate for the prevention of atherosclerosis events. Definition: it is a slow, progressive disease that may begin as early as childhood. It is the buildup of fat, cholesterol, and other substances in the artery walls. This buildup is called plaque and can cause the arteries to narrow, blocking blood flow. It can also burst, leading to a blood clot. It is often considered as a heart problem that can affect arteries everywhere of the body. The exact cause is unknown and may start with a damage or injury to the inner layer of an artery and may be caused by high blood pressure, high cholesterol, high triglycerides, smoking habit, insulin resistance, obesity, and diabetes. Also can be caused by inflammatory disease such as arthritis, lupus, psoriasis, and inflammatory bowel disease. Can be treated and prevented by having a healthy lifestyle. Mild atherosclerosis usually doesn't have any symptoms until the artery is so narrow and clogged that it can supply enough blood to the organs and tissues. Sometimes a blood clot completely blocks blood flow or breaks apart and can trigger a heart attack or stroke. Symptoms of moderate or severe atherosclerosis depends on which artery are affected.
Atherosclerosis is hardening and narrowing of the arteries. Arteries are blood vessels that carry blood from the heart to all parts of the body. Over time, small tears in artery walls develop, and particles called low-density lipoproteins, LDLs, can get lodged in these tears. Lipoproteins are like package carriers. They transport fats, mainly cholesterol and triglycerides, from place to place throughout the bloodstream. As these LDLs get stuck in the wall, the body responds by sending in white blood cells to take care of the situation. But this doesn't work. The white blood cells eat up the LDLs and end up dying off. As this process happens again and again, a plaque-like substance develops and gets bigger and bigger. This doesn't happen overnight. It takes a long time for this plaque to get really large. So eventually what happens is blood flow is restricted and can even be stopped. And over time this can lead to stroke or heart attack. The main risk factors for developing atherosclerosis include smoking, high cholesterol levels, high blood pressure, abdominal obesity, stress, poor nutrition, including overconsumption of foods high in saturated fats or added sugars, and not consuming enough fruits and veggies, overconsumption of alcohol, and lack of regular exercise. By making lifestyle changes to lower the risk factors just mentioned, it is possible to slow or stop the development of atherosclerosis.
Application in medicine. In February 21, New England Journal of Medicine published an investigation with a hypothesis in relation of the action of low-dose methotrexate for the prevention of atherosclerosis events. They suggest that the benefit was in relation with inhibition of interleukin-1b, interleukin-C, and C-reactive protein. Low-dose methotrexate, it is used in patients with arthritis, lupus, and psoriasis, in which they observed that this group of patients had less cardiovascular events, but they conclude that the patients with stable atherosclerosis, low-dose methotrexate, it didn't reduce levels of interleukins or C-reactive protein, and this not result in fewer cardiovascular events.
So the cardiovascular inflammation reduction trial, for me, is fascinating because at first sight, the implications are, here's a negative trial, but actually it tells us something really interesting about the biology. We know that the IL-1 beta, IL-6 pathway from the inflammasome is implicated on the basis of the previous CANTOS study. Now here's a different approach without selecting individuals at high CRP, using amount of methotrexate that was sufficient to influence the hematological markers, but it did nothing. And it did nothing to the IL-1 beta, IL-6 pathway. So I think that this tells us that that pathway is crucial in terms of modifying inflammation and plaque behavior.
I was surprised it didn't lower C-reactive protein, and Dr. Ritker is the PI. So why did Dr. Ritker choose a drug that doesn't lower C-reactive protein to test? But it certainly is a nice trial to show that you can't just use any old anti-inflammatory drug. You have to use ones that meet specific pathways. And certainly with the results of the CANTOS trial, the IL-1 pathway appears to be the one to approach. But it didn't disappoint me or discourage me about the idea that directly targeting inflammation can still be beneficial for cardiovascular patients.
I think that with each of those trials, we've got to specifically look at that pathway. And we've got to look at the questions of, is the extent of dose sufficient to modulate that pathway in the plaque? Because if not, we may be facing another negative trial. There have been some interesting trials with colchicine already that look encouraging, but they were small.
And so I would like to have some sort of direct anti-inflammatory agent that has been demonstrated to help cardiovascular patients available to my patients. And then I'm also excited about the LODOCO-2 trial because colchicine is inexpensive. It's been shown to be very safe. It's already used for not only treating gout, but for treating other cardiovascular things such as atrial fibrillation and pericarditis. And so it might just fit right in if it becomes evidence-based by the LODOCO-2 trial. So I'm excited about that. And I'm also excited about other agents that might be targeted now that people know which direction to go. There have been other anti-inflammatory agents that have not worked, and so now we might have some that will work, especially now that we should probably concentrate on the IL-1 pathway.
Pros and cons of methotrexate. Pros, it is economic and highly used for inflammatory disease. And cons, methotrexate can cause high levels of hepatic enzymes, a reduction of leukocytes and hematocrit, and a high risk of skin cancer.
Hi, I'm Andrew Jordan, one of the rheumatologists at BJC Health. Today I want to talk about methotrexate. Methotrexate is one of the most commonly prescribed medications by a rheumatologist. Why do rheumatologists use so much methotrexate? Well, it's because it has some of the best evidence for treating rheumatoid arthritis and psoriatic arthritis. When we use methotrexate, it has good use in treating your pain, your stiffness, and also in preventing joint damage for future protection of your joints. Methotrexate is usually taken as a weekly medication. This is appealing in the sense that there is less medication and tablets than some of the other medications you might need for these conditions. Of course, some people do get problems with methotrexate, and I'd like you to tune into one of the other videos where I'll address some of the myths and problems with methotrexate.
It should apply in Ecuador. In Ecuador, it is common to the use of methotrexate in inflammatory disease, especially in rheumatoid arthritis and psoriasis. Also is used in cancer like acute leukemia, no-Hodgkin lymphoma, solid tumors in lungs, head, neck, cervix, ovary, and testicles. Conclusion. In conclusion, the best and effective way to prevent atherosclerosis is a healthy lifestyle such as exercise, a good diet, no smoking, and get routine checkups.